Welcome, everyone. Again, we're going to have a fun evening. We're doing our third annual Knees4Skis, and this year we've added some twists to our night. But as usual, the idea is to put some thought into skiing, ski equipment, nutrition, exercise, planning for our ski year. And we've got some special guests tonight. And I'll start with some introductions. First, my co-host is Lynne Richardson, a lifelong skier. She ski raced when she was young. She owns and runs Rocky Mountain Rehab in Canmore and is a physiotherapist and has traveled with skiing with physiotherapy and is just passionate about dealing with people that have had ski knee injuries and other ski injuries. And it's just been a part of her life. And we've had a lot of fun with this over the years. Also, I would be remiss without introducing the team behind us. Julianne Fran has been basically the quarterback of setting up the IT, getting our slideshows together, and she's worked at Banff Sport Medicine Foundation now for 3+ years. I don't know how many, Julianne, it has been, but she's a real backbone to our foundation and our program there. And then even further behind the scenes has been Sarah Kerslake, who's our research quarterback, and really she runs the show in the background for most of our education programs and most of our research, which is a huge part of growth for us over the years, is to really look at injury and how can we improve in the future. And this is part of that educational series. Tonight, I've got a couple of special guests. First, we're going to have more of the Richardson family come. We've got Grant Richardson, who's a ski coach, who's going to give us some tips on just skis themselves and bindings and boots and that whole language to understand what is DIN, what is canting, what's forward pressure. So I'm excited to bring him on to get some basics in the actual ski and boot and binding itself, just for background knowledge. His daughter Britt is going to help us demonstrate some exercises, and it's kind of exciting. She's just got back from competing in her first World Cup, so she's a lifelong skier, and she's volunteered to show Rusty, Lynne, and I a thing or two about our exercises when we get into that. And then lastly, I want to say that a real special guest is coming from the Kootenays for us, Dr. Delia Roberts. She's a PhD in medical sciences, but she's been 25 years at Selkirk College, and she is passionate about ski industry and multiple sports, but in regard to the whole nutrition, sleep, all of those facets that we kind of take for granted sometimes. So she's going to give us some insight into that component of knee injury prevention, and quite frankly, just how to optimize your skiing and how to prevent injury, not only knees, but in the whole sense. So now we'll get on with the show.
We have to introduce you.
Yeah, oh, sorry.
For those of you who don't know Dr. Mark Hurd, most of you probably do, but he's our infamous orthopedic surgeon from the Banff Sport Medicine Clinic, where he's been about 30+ years. And he's fixed many a knee in the Bow Valley, lots of ski racers and coaches and ski instructors and mountain guides and lots of weekend warriors. He's fixed many people's knees in this valley. He's worked with Alpha Canada over 30 years and travels a lot with the team over all those years. And we're just really lucky to have him in this valley. And I'm honored to co-host this Knees4Skis with him. So thank you everyone for coming tonight.
Yeah, thank you. We'll get the PowerPoint going. And the whole concept is you in the audience, please ask questions and put up comments and be interactive. And Julianne will return the questions to us if you put them in your chat box. The other thing I would say is we're going to do this in a question-based format, and you will be able to live answer the questions. And I think it should become obvious on the screen when we put up a question. we will ask the audience to answer the questions and we'll get live time answering. So something we haven't had in the past is a sense of what people's thoughts are. And totally, this is really just supposed to be fun and have a dialogue and conversation. So on with the show. To get into this topic, it's good to have a little anatomy. And you have a knee on your screen, but I'm going to bring up a knee in front of the camera as well. And the significant features of the knee for tonight's talk are the cruciate ligaments that sit in the middle of the knee. And if you think evolutionary wise, mammals were designed to run, to flee, to go forward. But in actual fact, the twisting and rotation, especially with advanced sport, is been a new concept for humans. And so ACL injuries have been epidemic. Soccer, ultimate frisbee, and of course skiing with this big lever arm. And so knowing that the anatomy of the knee, these cruciates lie in the middle of the knee, and they aren't very strong for rotation. So catching a ski edge, jumping off a jump can tear those ligaments. On the out and inside of the knee, we have the lateral collateral and the medial collateral, but I'm not going to get too much into it because the most precious part of the knee is the lining of the joint, the articular cartilage. And one of the major reasons we want to fix knees, and we want to fix knees when they're initially injured, is to prevent further damage to the articular cartilage. So I think we've got that going now. So the lining of the joint is the articular cartilage. And everyone's heard about, oh, I tore my meniscus. Well, meniscus are these O-rings, and you can see a meniscus on the side of the picture. And I fashioned a meniscus to the red seal around a pickle jar. When your mom or your grandmother's done some pickling, that red seal prevents the pickles from getting spoiled. If you tear or break that ring, they spoil. Well, it's the same with the knee. When you get tears in the meniscus in the knee, you get damage to the knee. So I want you to think in the back of your mind as we go through this talk that the ACL is truly only the stabilizers. The pain, the disability, the progression to arthritis is due to the damage to the lining of the joint and the meniscus. And that's a concept I want us to think about as we go forward tonight. Let's head on to the next slide. Just having trouble getting back to that slideshow. There we go.
Okay, so we're going to ask some questions, and like Mark said, you want to try to answer them yourself. So what is the most common mechanism of an ACL tear while skiing? Is it one of those slow, twisty turns? Is it a high velocity crash yard sale where you tumble down the whole hill? Is it landing in the back seat? That means really back on your heels. Or is it hitting a tree while skiing? A, B, C, or D?
Now, on your screens, you should be able to hit a pole.
And if not, just think about it.
Yeah, we'll see if this works or not. Okay, so unfortunately, our live polling is not working. Knees4Skis has had trials and tribulations before. We're going to carry on. So we'll go to the next slide, Julianne. And so the answer is, well, A, B, and C are mechanisms of tearing an ACL. The most common mechanism we see is actually a slow twisting turn. you're kind of tired, you're a little fatigued, a little bit in the back seat, and you get a slow twisting turn. And that's what is our most common mechanism. It's funny when you see someone go down a couloir and have a huge yard sale, and they get up at the end and they've got their arms in the air and they're cheering. Well, it's amazing how those people don't get hurt. In big energy, in the terrain park, landing in the back seat can tear an ACL. But again, it's the slow turn is the most common. Hitting a tree tends to tear the posterior cruciate ligament of the knee. And so D was not correct. I think we'll go on to the next slide there, Julianne.
Okay, question number 2. Immediate surgery, is it optimal for an acute ACL tear in a skier? Is that true or false, that we should get you in for surgery right away?
So the answer for that is when you initially tear your ACL, your knee's really angry. And it's often best to give it time to settle down, to get the swelling out of the knee, to get the range of motion out of the knee. There are a few circumstances where a meniscus is flipped in the gears and the knee is truly locked, that immediate surgery is necessary. But in actual fact, we have less complications and an easier recovery if we do an ACL reconstruction somewhat delayed. Now, in the public health system, sometimes there's waits for months. And generally, if you keep linear, ride a bike, do anything in a straight line, you're not going to injure your knee. And so it's actually okay to wait to get your knee fixed. What you don't want to do is at 6-8 weeks when your knee feels better is to go back to twisting sports, get your skis on again, go back to soccer or ultimate, because that's when you really injure your knee. So it's that, yes, it's good to let the knee settle down, but you don't have to do it right away.
And it's a good time to team up with the physio as soon as you hurt your knee. And so we can help walk you through the next steps, what you should and shouldn't do leading up to the surgery.
Yeah, and I'll stress that as well. Traditionally, people were put in a knee splint in the emergency department, locked straight. The knee would get stiff. People were apprehensive about moving their knee. And in fact, almost in every situation with a knee injury, motion right off the bat is good. And having a therapist guide you through that initial recovery is really helpful and really, I think, a good adjunct. So think motion, think early. And those of you that are coaches, those of you that are in the ski industry and deal with athletes or skiers that get injured, that's a good tip. Not only, get your knee checked out by your doc, but in many senses, it's almost better to see a physiotherapist to get it going. And they are good at assessing this injury. Next slide.
Question number 3, ACLs injuries are easy to diagnose. Is that true or false?
So the truth is ACL injuries are hard to diagnose. And everywhere people are trying to teach that have a high index of suspicion for mechanism. Someone who does have a twisting fall skiing likely doesn't just have a knee sprain. There's a high incidence of ACL tears when you ski. And so having an index of suspicion. When you go into the emergency department or see your family doctor, your knee is angry, your muscles are in spasm. It's hard to examine, but having that index of suspicion, getting the knee moving, re-examining, coming back to it is really important. And so I think that's something that people should be aware of, that they are missed a lot. And keeping that in the back of your mind, if you're told, oh, you've got a sprained knee, it'll get better. I think that education is getting out there, but it could still get out there more, and you can help with that form.
Question 4, ACL tears never heal. Is that true or false? People ask us this in physio all the time. So,
yeah. So the ACL does sit in the middle of the knee and it's got a poor blood supply. So it is not a great healing ligament, but the slow twisting turn that we often find in skiers. Oh, I was skiing in heavy snow and I wound up my ski, I felt a pop. Those lower energy ACL tears can heal. And that's another reason to give them a chance to have some healing time, because initially you get assessed and the knee may be very loose. And then 6-8 weeks later, all of a sudden the knee's tightened up. And then you could say, what are my demands? What are my wants and needs? And there possibly may be a good way of proceeding without ACL surgery. So yes, ACLs do heal, but they don't heal well.
Some skiers can cope with an ACL deficient knee. ACL deficient meaning that it's loose or lax when we test it. Is that true or false?
So that is true. Many a skier has skied a whole career with a torn ACL. And skiing is a funny sport in that regard. When you're skiing properly and you're on your skis, you actually don't need an ACL. It's a very dynamic sport that you're not twisting like soccer, like ultimate. Some of those other sports are harder to cope with, but skiing is a sport you can cope with. Having said that, there are some people that are better copers than others, and that depends on your body composition, the shape of the bones, your ligamentous laxity, your strength, and all of those things. And Lynne's going to talk about a patient she's had that has really struck home for me, because I've seen this patient too.
Yeah, so she was skiing at Lake Louise, fell, her knee popped, instant pain, and then it felt better, classic ACL tear. She saw 2 different physios who did the ACL test, and her knee clearly felt loose. And then we referred her on to Dr. Hurd, and he thought definitely she had a loose ACL as well. So surgery was recommended if she wanted to continue to ski and do all her sports. And she healed quite quickly, and she went on to do running and horseback riding and skiing and skate skiing, and she had absolutely no instability in her knee. So we went on to get an MRI of her knee, and in fact, she had a completely torn ACL, but she didn't feel unstable. So she didn't want to get surgery. The next season, she tore her other ACL, and she had the exact same symptoms. Clearly, on women tested it, it was loose and unstable, but she was able to cope and do all of her activities without feeling her knee give out. Most people have some feeling of instability, and that's why they want to get surgery, but she was able to cope. So we call her a coper. She has very strong quad. She's very fit. She has very good neuromuscular control, and she's one of the lucky ones.
Yeah, so this makes it a dilemma for us as healthcare providers of what advice to give you. And I tend, when someone sees me with a torn ACL, first of all, find out what are their demands? What do they want to do? Do they want to race on the national ski team or the Alberta ski team? The odds of hurting their knee again are super high. I ski 10 times a year, and I love to cross-country ski, very linear, and I'm not feeling unstable. And so over the years, I found about 1/3 of people can cope with a torn ACL, with or without a brace. Some people do use a brace and don't mind using a brace. And there's a lot of science that say braces do help. They're not foolproof, but they do help in stabilizing their knee. And then another third will change their lifestyle. They'll get to a point in their life, they say, you know what, I think I'll pass on the downhill skiing or pass on the soccer or give up my basketball career and move on to more linear scopes. And then about 1/3 of the patients will pursue surgery. The dilemma for me is I hate to see someone who's torn their ACL have their second injury and injure that articular cartilage or meniscal cartilage, which causes the arthritis. Hence, it's a tough topic to talk about, but I want to bring that to the forefront, that there's no one path. There's paths for everyone, and it's an individualized treatment.
You should not ski with osteoarthritis. True or false?
Well, if it was true that you shouldn't ski with osteoarthritis, I shouldn't ski. And I love skiing. I've torn my ACL and I've had it fixed because I want to prevent knee arthritis, but I do already have some knee arthritis under my kneecaps, and it's common. People that have hurt themselves in their 20s or teens, often years later, will have some osteoarthritis in the knee. And the truth is for someone who's got osteoarthritis, being active is better for you. It's better for your overall health. It's better for your joint health. And so I want to encourage people with osteoarthritis, keep skiing. We're going to give some tips about warming up, volume of skiing, getting everything in moderation. And a big tip is changing seasons. When you get back into the winter, don't overdo it on the first day. So I'm really wanting that message to get out there. If you've got a bit of a rusty knee, keep skiing. It's better for your health.
Just avoid the cliffs.
Maybe avoid the cliffs. Yeah.
Okay, prevention. The following factors are associated with knee injuries: equipment, diet and hydration, fatigue, fitness, A and D, or all of the above. Which are factors for knee injuries?
So with knee injuries, it is multifactorial. And hence, we're going to do a little session on skis tonight to talk about that and boots. But we're also going to do a little session tonight on hydration, food, alcohol, sleep, and kind of cover some of the other parts of that. And having a knee injury is sometimes like the perfect storm. I was out, had a couple extra beers with the guys, and early wake up, so not great sleep. And then, I borrowed my neighbor's skis because I forgot mine in Calgary. And all of a sudden, all these things add up. And so the answer is all of the above are important. So I'm going to introduce Grant Richardson, and we're going to just talk a little bit about ski equipment. And what I might just do is just ask Grant some questions and get him to give us some ideas. So Grant, if you're going out and getting a new pair of skis and you're getting all set up, what are some of the things you should think about for preventing yourself getting hurt?
Sure. Thanks for having me here, Mark and Lynn. And our equipment choices should be made by professionals in the industry in terms of length of the equipment. There's side cut of the equipment. Side cut is basically we have a ski that's wider at the top, narrow in the middle, wider at the tail, and that is side cut. And the ski length and the type of ski you want to get for your, if you're a big mountain skier, you like powder, that's a different ski than this ski. This is a race ski. And there's all mountain skis for groomers, and selecting the right kind of ski for your kind of skiing is important. Bindings are different. This binding, it goes up to 18 on its DIN. A lot of people don't need that. Many people don't need that. So making sure that there's enough DIN for your ability is important. Playing with the DIN in a ski is something a professional should do. I'll probably repeat this a few times because we want to talk about some of these concepts and make sure that people are aware and exposed to some of the concepts. But at the same time, we definitely need people to go to a certified technician to get bindings adjusted, and as well as, and especially the DIN.
What is DIN, Grant? Like, I hear that number thrown all over the place, and I don't really know what it is.
Sure, I can explain that, Mark. Hold this up to the camera here. We've got numbers. This is a toe piece, and it's got numbers on it that indicate the DIN. I've got on the heel here, we've got the same. And anyway, the number of DIN is determined. What determines that is your skiing ability, your height and weight is primarily what goes on. Technicians in stores have to get certified, and you have to fill out a form that indicates whether you're an expert skier or a novice. your accurate height and weight, and then they can adjust to the type of skier you are and your height and weight. So that's super important. So this is, if you're going to borrow some skis from a friend, then this is something, your friend might have the same size boot as you, but he may be 200 pounds more than you. And his din is set up way too high for you, and it creates a dangerous situation for skiers that are on a din that's way too high. Another concept here with binding adjustment is the forward pressure. I'll just move this closer to the camera here too. So this screw, I don't know if you can see, the screw has a line on it, and we turn the screw in and out. When that should disappear, that line would disappear if the boot goes in the binding. So that's forward pressure, and just every binding needs to have forward pressure adjusted accurately. Again, if you're borrowing equipment or getting your stuff set up for the first time, that's an important concept for sure.
Yeah, so if I go in and get my ski set up, and I do my first run and I step out of my ski, I'm going, what the heck's going on? What's likely happened?
Yeah, probably the din is too light for your weight and ability, or the stuff that you're doing.
Right.
And that could be that you didn't fill out the form properly when you were with the technician in the ski shop, and you told them that you were a novice or an intermediate when you're actually an expert, and you're just doing things that you're going in the terrain park and it's set up for somebody who's just supposed to be on the.
Yeah, and I have to admit, the concept of forward pressure is new to me. That's to put the boot into the toe piece properly. Is that that's the whole concept of that?
Yeah, and every ski company manufacturer has a different. I just showed you the line on that one screw. Some have a gauge where there's a line that needs to be between certain parameters on the ski. So every binding company has a different way of doing forward pressure. In terms of din, that's more of a universal thing across different manufacturers.
Yeah, and I have to admit, I've got a couple stories of young skiers who went to a race, had their dins cranked up for a race, and then they went free skiing after with less energy than race and tore their ACLs. So I think it behoves coaches and and athletes and skiers themselves to kind of know what circumstances they're skiing in. And it's super helpful to learn a bit of the language, because I have to admit I'm ignorant in it. So we've kind of talked about the ski a bit. Tell me about the boot. Everyone kind of says, oh yeah, I'm heading in to get my boots canted and my forward tilt done. That's kind of Greek to me. Can you give me a little idea of what they're talking about?
Yeah, sure. So again, professionals should do this. It's not something to play around with at home or on your own if you're inexperienced. Boots there's a lot to a boot. First of all, there can be, talking about canting, the boot is made up of two pieces. We have the sole and we have the cuff. And the cuff can be canted right here at the hinge. And then in the sole, we can cant that either inside the boot or outside the boot. As ski coaches, we might play around and put some duct tape on one side of the heel and the toe where it connects with the binding to create a little cant that goes one way or the other. So we can put the tape inside or outside. And then if we figure out that that's a better thing for that athlete, and ski shops will do this for you, boot fitters, then we might make it more permanent. I'll just demonstrate here with a little. So there's a very thin plate at the bottom of the boot here. So we could put some duct tape or some kind of filler in there on more of a permanent basis that has the boot canted all the time.
Does everyone need canting?
No, definitely not.
Yeah, so if I'm kind of neutrally aligned and my alignment is good, I might get away without canting. Whereas if I'm bow-legged or super knock-kneed, or I'm a pronator, I'm more likely to need some help with that.
Absolutely, yeah.
What about forward tilt?
Yeah, so the binding is set up that way to create ramp angle, we call it. So it'll be thicker in the heel piece and thinner in the toe piece in most circumstances to create a bit of ramp angle. The boots can be set up the same way. In some cases, the boot board in the bottom that's inside the boot, I'm just pulling this out of the boot here. This is the boot board. And this can be shaved down, which is helpful to create, it can create different ramp angles that way by shaving the front or the back of the, grinding that down. That can also create space in the boot if there's space issues and the boots are too tight. So that's one option on that. In ski racing, we also have, I'm gonna bring this close again. So we've got, this is a very thin piece of plastic. It's called a lift. And if you look really close in Brit's skis here, that's between the plate and the binding. There's some of these lifts. So if those are put in the heel piece, we can create more ramp angle that way, or less ramp angle if we want to put it in the toe piece. A lot of slalom skiers will be set up a little higher in the toe, trying to level them out a little bit, rather than going with so much ramp angle that comes with the traditional binding setup.
I'm a ski tour. I love to ski tour, and I bought a new pair of boots. And when I went out the first time, I felt totally in the back seat. I felt my skis getting away on me. And when I looked at the back of my boot, I realized there were a couple different settings for boot angle. When would you consider pushing someone more forward and when back?
That's tricky, especially comparing ski racing to touring. A lot of times in a ski racing boot, there's a spoiler in the back of the liner that's not, I don't have the liner with me tonight, but that can be taken out or put in to create some of that. The boots have walk mode. Your boots for touring have walk mode or a ski mode, ensuring that the boots in ski mode, and some of the boots have 3 different settings, I think. So adjusting the back of the boot for those various things. So to ski down in walk mode is obviously walk mode is to climb up, and skiing down in that wouldn't be a safe scenario.
So I would put it to us that the reason for bringing up these topics isn't to become an instant expert in them, but it is to be aware that the equipment is important and can contribute to a knee injury. And being put in the back seat can cause an ACL tear. As a general concept, and you can correct me as you're wrong, you want to ski on top of your skis. You don't want to be in the back seat. So the reason we thought we'd add this today is to add some language to what things are, but also to be aware that if you're not sitting comfortable on your new gear or your borrowed gear or even your old gear, that looking at some of these things might actually prevent injury. Absolutely. I want to thank you. Do you have anything else you wanted to bring up? Yeah, they got a couple questions.
A few questions.
Sure.
One is interested in thoughts on backcountry bindings. Some tech pin bindings don't release at the toe. Some do, but have other problems like fussy, don't transition well. What does Dr. Hurd use or recommend since his injury and reconstruction?
It's a good question. And there are in the backcountry coming out new versions where the toe piece does release. But I have to admit, I've used a Dynafit type system since the 90s. So for a long time, 20 plus years, I tore my own ACL catching a tree and not having the toe release. So a little bit guilty. I think having it in the release mode is good. I use them because I'm kind of old and fat and they're lightweight. So that's why I like Dynafit. But on a serious note, I think the industry is responding, and a few of the companies are saying, let's get some toe pieces that swivel and give out. I think all of these things are personal preference, but it is the awareness of buying a Dynafit binding slightly increases your chance of your toe not coming out and probably slightly increases your chance of tearing your ACL. So I think it's an awesome question. Yeah. Do you have any thoughts on that?
No, I don't do, I ski coach and don't do a whole lot of touring. So I think you're going to answer that question better than I would.
One more. When listing your weight, should you include the weight of your boots?
That's a good question.
Oh, in the ski shop, when you're filling out the forms, no, they're just looking for your natural weight without any clothes on, really. So they'll look for that weight and height, and then they often ask for your ski ability, which goes from novice to expert. One other thing I wanted to add is typical, or I guess with the ski and the boot, we have a lot of side cut in the ski, and when we put the boot on, it's relevant to this talk that it creates a lot of lever forces that when the ski is on edge and it hooks up on you, the ski and the boot act really significantly on the joints of the knee, primarily the knee, but also potentially the hip. And so that's why all this setup is so important, is because this is the force that's tearing your ACL is coming from your equipment to a large extent.
Yeah.
So I think that's important. The G forces, the power that's in a turn, the way that you can get back and twisted, and the ski just keeps cutting, is that's where a lot of these ACL injuries are coming from. And so I think that's why we're here talking about equipment.
Yeah, and that's why we've added that this year, is just for that awareness. And I want to thank you for adding that to us. All right, let's continue on, because we're going to have a couple more questions, and then we're going to get our second guest on.
Okay, this slide is just about making good choices. So when we're skiing or doing any sort of sport, you make good choice. You make choices all day long: where you're going to ski, which run, how many runs you're going to do, how hard you're going to push yourself. And just the point here is that you try to minimize. If you've done all your ski fitness and you've got the good setup on your equipment, and now you're skiing, make some good choices. If it's really poor light and really crappy conditions, maybe don't ski anymore, because you might hurt your knee. Time of day, so many injuries happen at the end of the day when people are totally fatigued, and they want to do one more run and then they blow their ACL that time. Or time of day, if you're a really stiff person in the morning, maybe not starting at 9 o'clock on the first run, maybe waiting and doing a bit of warm up and going later in the day. And ski within your limits. Sure, we all want to push ourselves, but to a degree, because you want to ski the whole season and not carry your ACL.
Right on.
Research supports exercise prevention programs to decrease the rate of knee injuries. Is this true or false?
So it's absolutely true. When I started working in the ski industry and we started writing papers about ACLs, there was a tremendous paucity of literature and study. And over the last 20 years, there has been increased evidence into preventing ACL injuries, etiology of ACL injuries, the mechanisms of ACL injuries, and we continue to glean more and more information on that. And there's really good programs, some overall programs like the FIFA 11. It's a soccer-based program, but it can be used basically with any athlete. And the PEP program out of Southern California, Prevent Injury and Enhance Performance, you can get these on the internet. The NCAA has some big missions in trying to decrease their injuries in NCAA, volleyball, basketball, soccer, all those sports. And then we also have some good information coming out of Selkirk College. And the Fit for Snow is kind of the quote for that overall package of prevention. And so at this time, I'd like to invite Delia Roberts. We're going to have her come on, and she's going to give us a little bit of insight in some of the other aspects. So I'm going to turn the stage over to Delia. Welcome, Delia.
Super, thanks so much. And I really want to thank everyone at the Banff Sport Medicine group for inviting me to come and share this information with you. So while my work really has been focused on worksite injury prevention, it really is very applicable to anybody who wants to spend time on snow. And because the research was done with people who spend a lot of time on snow, I think it is quite applicable. So the work initially was conducted with ski patrols, instructors, and lift operators, because they're the groups at the ski resorts that have the highest rate of injury. But I have also conducted the same types of work with all kinds of other industries, including physicians. So you'll see that I did make sure that Mark had breakfast before he fixed my knees. Anyhow, the point here is that this type of work addresses both the types of prevention strategies that Mark and Lynne are talking about, and you'll see them coming a little bit later. But one of the aspects of it is to look at fuel supply. And in this case, what we're trying to do is delay fatigue. So we're gonna give the muscles the energy that they need. But we're also gonna try and supply our nervous system with fuel, because it's the nervous system in terms of your brain that is helping you assess risk and make good decisions. And it's the nerves that are connected to your muscles that are going to help your joints and recruit the right muscle at the right time to stabilize the joint and support those fairly fragile ligaments that we really don't want to damage. So if we look at our first question here for the poll, if I could have the first slide. Which breakfast would you choose for a day of skiing or riding on the hill? So our choices are nothing because you're not hungry, maybe just some coffee, your nice greasy breakfast with sausage, bacon, and eggs if you believe in sort of the paleo ketone approach. Oh, maybe it's that cinnamon bun that just smells so good when you walk into the lodge. And maybe you're on a bit of a budget, so you choose oatmeal with some nuts and dried fruit and a little bit of milk or yogurt. Okay, so let's look at the next slide and we'll have the answer. All right, so what we're gonna look for is a breakfast that combines both carbohydrates, proteins, and a little bit of fat. And our problem is that when we start our day after an overnight fast, our blood sugar is at its absolute lowest. That's problematic because our nervous system, both our brain and those all important nerves that are carrying information out to the muscles, receiving information from the joint about tension and pressure, well, they rely on glucose as their primary fuel. It is possible for them to adapt to ketones, but in every single performance study that's ever shown an advantage from a ketone diet, they actually supplement with carbohydrate during the activity task, during the exercise task. What we do know is that when you eat something that tastes sweet, so it has the simple sugars, they're already released from the carbohydrate structure or from any of fiber that surrounds them. So they are absorbed very, very quickly. And when blood sugar rises very quickly, we release the hormone insulin. So we have a problem there because blood sugar spikes upward and then about 2 hours later, it tanks out. The research that I've done shows that we can measure a change in reaction time when that happens. And it's actually those cycles of highs and lows that are problematic. So I had a little handheld reaction time device and it looked at simple reaction time. In other words, how quickly can you react to an unexpected stimulus? But it also looks at how good your choice or your response is. So we're looking for accuracy there in terms of your decision making. You don't want to have too much fat in your diet. So while you might think that that really greasy breakfast is going to last you all day, the problem is that it takes pretty much all day to digest. So fats don't mix with water. And when the concentration of the meal that you eat is higher than about 30% fat, it actually really delays digestion because all of that has to be emulsified before it can move through your digestive tract. So really what we want to try and do is combine complex carbohydrates, so foods that are relatively unprocessed that have a lot of fiber in them, with a little bit of fat so it lasts a long time. And then, of course, a bit of protein because the protein also will last you a little bit longer. So that way we can smooth out those spikes in blood sugar and delay the insulin response. And the data that I have from about 15 different ski resorts shows that the injuries, both in employees and guests, really cluster at the 2 points of time in the day where you expect that kind of spike and then the trough afterwards. So by simply changing up the diet a little bit, there's about a 40% reduction in injury rates. It's pretty significant. Okay, the next slide. Now I know that people aren't going to like this question, and it is kind of sad because obviously spending a day at the ski hill afterwards, we often like to share a bit of brew with our friends and talk about our skiing day. So, is beer a good recovery drink? And if we go to the next slide, we'll get the answer. So the problem that we have with anything that contains alcohol is that it's actually going to act directly on the kidneys to prevent our ability to reabsorb water, and that leads to dehydration. And dehydration has also been shown, there's quite a bit of literature in the sports world that shows that even a pretty mild dehydration will impair both physical performance as well as cognitive performance. So the same kinds of things that we saw with those shifts in blood sugar, we also see when people are dehydrated. One of the things that I see often when I'm out there at the hill is that people don't like to drink water during the day. Part of that is they don't like to carry a water bottle, but also, you know, if you drink water, well, then you're going to have to pee, and, you know, they don't want to stop and go in and use the washroom. So that's a bit of a problem because that dehydration is really going to allow you to better enjoy your day. It can alleviate the fatigue and certainly in terms of your ability to react when, let's say, your ski hits something that you didn't see, maybe a ball of ice, or it goes into a deeper bit of powder. So the way to get around that is to sip your water instead of chugging it. And there are these nice water bottles that you can buy these days that are soft and they fit into your pocket really nicely. I really like the hydration systems where you have a hose with a bite valve, but in the wintertime, it's problematic because they tend to freeze up. So you can now actually get ski jackets that have a proper sleeve in them to protect them so they don't freeze up. But what happens is that when you drink more than about half a cup at a time, the water moves into your bloodstream very quickly, but those tubes are very, very thin. So the bolus of water is kind of like that chunk of water circulates around, and it takes it a while to really mix in with your blood. And as it passes around the receptor that tells how concentrated your blood is, it kind of fools it into thinking that it's excess water and you pee it out. Also, when the water passes across your throat, it shuts off the thirst reflex. So thirst is not really a very accurate indicator of whether you're dehydrated or not. So what I really recommend to people is get yourself one of those nice small water bottles and just take a sip every time you're on the chair, just a mouthful or two, and that will keep you hydrated and keep the fluid inside of your body. The last piece that's worth talking about is the carbohydrate content of the beer, because it is important to consume some carbohydrate at the end of your ski day, especially if you've had a really, day where you've really gone for it and you've really, your legs are feeling very tired, because there's a limited amount of carbohydrate that's stored in your muscle. And that's the carbohydrate that actually fuels your legs while you're skiing. But we can kind of trick our bodies into recovering much faster if we have a high carbohydrate snack immediately following exercise. And the type of exercise that we experience while we're skiing, and I'm not sure, maybe a little bit later, Lynne will talk about this, but when the muscle lengthens under load, as it does when you're resisting gravity, it actually can cause little tiny tears in the muscle structure. So having some protein afterwards will really help with rebuilding. So our recommendation then is to have a nice carbohydrate snack, and the recommendation there is not quite a gram of carbohydrate for every kilogram, but for most people, this is going to be a 200 to 300 calorie carbohydrate snack with a bit of protein thrown in. And it doesn't have to be exact, but what's really important is to get it in that first hour after the end of exercise so that your body absorbs it, sucks it up, and puts it right into the muscle. Okay. The last comment I will make is for those of us who are aging, and I did take a brief look through the photos of the participants, but for those of us with gray hair, getting that protein is extra important because there is quite a bit of evidence that for older people to maintain their muscle, we really want to make sure that we get that good quality protein. Okay. So I think that's my last slide, but I can't advance to have a peek to make sure, but I think that was everything that I wanted to tell you about tonight. There's lots more to it, and but I think staying fueled up is a great way to keep yourself sharp, prevent the fatigue in your muscles, and help your nervous system really support you while you have a great day at the hill.
Thank you so much, Delia. And as with the theme of tonight, you know, knee injury and injury is multifactorial, and you've given us some real insight into, boy, what we put into our bodies for fuel and how many beers we have at the end of the day is relevant. You know, when I think of the ski industry, how the breakfasts are almost always lined up with eggs, sausage, bacon, and high-fat breakfasts. You know, that's a takeaway message for me. Some of those things do affect your performance, and I'm positive we're going to have some questions. Now, are there any questions right now that you've got there, Juliette? So we're going to wait till the question part comes on, but you know, I might just ask you one. What if you do have 3 or 4 beers and you do have a little too much and you got to work the next day, you're on the hill the next day? What would be your advice to me? Late
Right.
at night, I've realized, okay, I had a bunch of beer. What do I do to perform better the next day?
Yeah. So thanks for asking that question, because that is the reality, is that for sure people will overindulge. And so there are a few tricks that you can use. The first one was to try and combat that dehydrating effect of the alcohol. And so I actually include this in my program as an actual strategy. But we recommend that people try to have, for every serving of alcohol that they also drink a glass of water. And then at night, before they go to bed, that they use a sport drink or a rehydration fluid. And the reason behind that is that the little bit of salt and sugar that are contained in those sport drinks really help keep the fluid inside your body. So on one hand, you have the alcohol telling your kidneys to offload the water. Having a bit of salt can really help keep that fluid inside your body. And then we also recommend that people try to eat a little bit while they're drinking, because one of the things that happens as you process the alcohol to get rid of it, you also consume a lot of the carbohydrate that's in your liver. And we want to make sure that you have that blood sugar nice and stable. So again, having a little bit of a snack before they go to bed, and then same thing again in the morning to make sure that they have a rehydration drink on the way into work, and that they really focus, or on the way up to the ski hill, and that they really focus on trying to make sure that throughout the day they're consuming probably a sport drink, and then really making good choices in terms of keeping their blood sugar stable through the day.
Yeah. So I've got one more question for you, Delia. I go for a ski tour and do a big day, and I'm starting to get some cramping at the end of the day, and I get back to the car Can you give me some example of that, the glycogen and protein snacks? Like I'm not savvy to know what I
Right.
should be eating. What should I eat as I'm driving back from K Country or Rogers Pass?
Right.
And just in that first hour and a half, I really like that tip, but I'd like a little more insight.
So the ski touring situation is probably a little bit different than for most people at the hill because the energy output is quite a bit higher. So I just caution people, if you're thinking about a day of downhill skiing, you might want to just balance out the amounts of food that you're consuming. So I think the first suggestion I would make is to snack. And I know there are some schools of thought that say, well, you shouldn't snack in between meals because it's extra calories and so on. But when your body is consuming that energy, your muscles are contracting and they're working hard, you really want to try and keep it topped up. So you want to try and prevent the glycogen or the carbohydrate in your muscle from bottoming out in the first place. And so pocket snacks, things that are high protein that aren't messy to eat, right? That you can keep in your pocket and eat quite quickly. Things, if you are a meat eater, like beef jerky and hopefully without too many nitrites in it. Nuts are always a favorite pocket snack, but the problem is that they're quite high in fat. So what I suggest to people is that you choose a cereal that's a little bit high in fiber and lower in sugar. And so things like Shreddies or Cheerios that don't have as much sugar in them and they are a whole grain cereal, maybe a few pretzels and a little bit of dried fruit, mix those in with your nuts so that you're diluting out the fat a little bit. There's also sort of a rule of thumb that you can use when you're selecting a power bar or an energy bar of some type. And on the label, you can look and see how many calories there are for fat. So that should not make up more than a third of the total calories. So you can look at it for digestibility. And the sugar content doesn't matter so much in that exercise situation because while your muscle is actually contracting, it's going to prevent your pancreas from releasing insulin. So the sugar will just go straight into your muscle. And in the post-exercise period, the sugar is great because the insulin is actually going to help your muscle take the carbohydrate up. And the sugar is even a little bit anabolic. So it almost acts a little bit like testosterone, the insulin does to stimulate muscle rebuilding. And there's, I didn't put it on a slide, which I probably should have, but there is a Facebook page called Fit for Snow. And on that Facebook page, I put all kinds of tips like this, but also recipes for homemade power bars or homemade power muffins that have sort of the right balance of carbohydrate and protein, a little bit less expensive, maybe have not so many preservatives in them. So those are also good choices. And you can always just save half a sandwich. If you're eating it in the car on the way home, that's also a really good choice. Some fruit with a little piece of cheese, any combination there of carbohydrate with a little bit of protein.
Those are awesome tips. I'm going to add some Shreddies to my nuts because I just love nuts too on the trail. We're going to get now on into the next phase of our talk. We're going to get some exercise going.
Yeah.
So, Lynn, what are the fundamentals of a pre-season ski fitness program? A, strength, balance, agility, biomechanics, and alignment. B, balance, extreme flexibility and strength. Or C, strong quads and hams.
The answer is A. So we need strength, balance, agility, good biomechanics, alignment, and good neuromuscular control. Back in the day, I think we used to just ride our bikes and do that, sit against the wall and have strong quads, but we didn't quite realize all the things that really we should have been doing to be really ready for the ski hill. And if you're really strong, but you have not very good balance, well, you might fall more often. And even though you have strength, you don't have good balance. So every time you fall, you might put yourself more at risk for injuring your knee. Or if you're not very agile and all of a sudden you're skiing along and you're really strong, but the little kid cuts in front of you, if you're not super agile to make a quick move, you might fall or you might hit the kid or you might hurt your knee. Also, biomechanics and alignment is really important. It doesn't matter how strong you are. If you don't have good biomechanics, you're putting yourself at risk, and we'll talk about that a little later. And just good neuromuscular control, that your brain is telling your muscles to what to do, and that you have highly tuned movements.
I can hardly look, I look forward to us working on these 5 or 6 components of getting ready to ski. Just one more question before we get into the exercises. What muscles are most important for a healthy skier? Is it your quads, hams? Is it your core? Is it your hips and gluteals? Or is it all of the above?
And it's definitely all of the above. So we don't want to have a very all-rounded muscle group strength, good biomechanics, and if you have really strong quads but weak hamstrings, or a really strong core but really weak shoulder muscles, like if you're not balanced, then you can put yourself at risk as well. So having good all-round strength and fitness is very important.
All right.
So
Now we get to exercise. We're going to invite Britt to be one of our models, and we'll kind of start with the warm-up.
Hi,
and
everyone.
then go for everyone. Go from there, and Lynn's going to lead us.
Okay, so we're just gonna, and I recommend all of you to get up and try some of these exercises. Don't just watch us do them. So the first one we want to talk about is 2-legged squats, doing a squat. Obviously, skiing is very much a up and down squat movement, and you definitely should have some squats in your program. So Britt's gonna.
Can we, before that, can you just tell me what you do on the hill, though? I know we kind of rushed out of the slide, but what's your warm-up? What do you do?
Right.
And I want to stress that, you know, I actually do have some arthritis under my kneecaps. And if I start cold and go do a full run, I ache like crazy. Whereas if I do warm up, I'm so much better. So give me some
Yeah, I
tips
think
on
we kind
warming
of
up.
went past that slide, but that's okay. So when you sit in a car, especially for us in Canmore, we drive to Lake Louise or Sunshine, you're in your car and you sit in the gondola, and it's probably a good hour. And then you get out and it's -15, -20, your muscles are sore. And all of a sudden we take the chairlift up and you sit there next to your buddy, and then you get off the top and you just go skiing. So it's a really good idea to warm up before you go skiing. And even if it's just 5-10 minutes, bottom of the hill or the top of the chairlift before you ski. And yeah, there were some slides of, you can first of all, you can do lots of hip swinging. So you can do figure 8s, holes in the snow.
In there, come on, there, Britt. What's your warm up?
Figure 8s.
I do these in my warm up, some lunges to get your quads warmed up, some like sit-ups to activate your core, some arm swings to get the whole body moving. Those are my main ones.
Squats.
So that's part of your routine.
Yeah, before every run we do a quick warm up, just 5 minutes even, just to get the body moving before our
There you
run.
go. Yeah, right on.
Okay, so at home, and all these exercises you can do with very little equipment. So it's great to go to a gym, but a lot of people, especially during COVID, couldn't go to a gym. So all you need is a physio ball, a piece of band, and we'll show you some exercises that you could do in your living room. So the first one is just 2-legged squats. We're just going to demonstrate. So back to the biomechanics and alignment, we really want, you can see how her hips are staying level, her pelvis is level, her knees are going over the center of her foot.
See, I need to warm up.
So what Mark was really doing bending forward a lot. So you want to
Keep your back neutral.
keep your back in a neutral position.
Holy cow.
Stick your bum out like you're sitting on a chair, and that gets your back more into a neutral position. Good. Okay, so you can make that harder by adding weights. Once you can do 30 squats, no problem. You can add some weights. These are 5 pounds, 8 pounds each, adds quite a lot. And then you can make it harder. Actually, go back. Once you're starting squats, you want to start with just a 30-degree squat. And as you progress, you can go into a 90-degree squat. And sometimes in skiing, we actually get way back on our tails and you have to pull yourself out of awkward positions. So sometimes it's good to do some deep squats so that you're ready for those positions that you don't necessarily choose to be in, but sometimes you get in them.
I will state though, that if your body says it's not happy at 90 or 100 degrees, don't go there.
Sure.
The kneecap itself is loaded the more we bend it. And so generally we're quite comfortable in the first 36 degrees. Yes, take that a bit and you might warm up a bit and then take it more. But don't go to pain. Don't go to where it's a real painful exercise.
Yeah. And then you can also add, once you're comfortable with squats, you can add some jumps. And again, really concentrating on your alignment, your back is neutral, your core is tight, and your alignment of your knees is over the center of your foot. Good. Okay, a lot of skiing is not 50-50 weight. A lot of weight should be on your downhill ski. And so we need to train being able to do one-legged squats. And it's amazing how many high-level skiers cannot do a one-legged squat very well. So the important part is to have, again, your pelvis is level, your knee is going over the center of your foot, and that you're nice balanced. So if you can train your body to work in this alignment, then when you're out skiing, it will do that, hopefully.
What about pistol versus behind for a single?
Yeah, both are great. It's good to mix it up. And go pretty hard pistol. Let's see it, Mark.
All the way down.
I got Brit for.
And again, you can make one-legged squats harder by adding weights or doing a one-legged jump.
And I'll tell you, if you can go to 90 degrees on a healthy knee, you're strong.
Yeah.
That is not easy. I use that as a test following ACL reconstructions for the last 30 years, and a very small percentage can get to 90 degrees. So that means you're exceptionally strong. Yeah.
Okay, now we're going to do some jump downs. So skiing, because it's an eccentric activity, there's lots of, you're going against gravity, you're going down, your muscles are lengthening. You have to be able to control your quads in an eccentric fashion. And so doing jump downs, you just stop off a step and do 2-leg jump downs, and you want to control that eccentric motion. We don't all want to take jumps, but sometimes the light is flat and all of a sudden there's a jump in front of you, or there's a cat track you didn't see, or you're avoiding a tree, and all of a sudden you do get a bit of air. So it's good to train yourselves a little bit to do jumps, especially even if you're older. It's good to do a little bit of eccentric work. So you can start with 2 feet off, 2-foot landing. And then you can progress that to a 2-foot takeoff, 1-foot landing. Again, really thinking about the alignment and the absorption. And then you can go a 1-foot takeoff and a 1-foot landing. Good. And you can make it harder by using a BOSU. Jumping on and off the BOSU. And if you don't have a BOSU, even just a cushion at your house will just add a little bit of imbalance and makes things just a little bit harder.
The more you add imbalance to your exercises, that trains that neuromuscular reaction, so that if something goes awry while you're skiing, you're quicker to respond. So if everything's controlled and linear, like a single leg squat, yes, it's helpful for position of body in space and strength, but you need to add some agility and reaction to it.
Right.
And so the BOSU ball or the pillow or whatever is a good progression. And I know we're going to progress further.
Yeah. Very important to work the hamstrings. A lot of people tend to work the quads a lot more than the hamstrings. So this is a really nice core exercise and hamstring curl. So it's going to lift up. And as she's pulling her legs in, she's activating her hamstrings. Because she's on a ball, it's an unstable surface, so it's actually quite hard. You can make it harder by putting your hands across your chest so you have less surface area on the ground. And then you can do one-legged as well if this gets quite easy for you. If you've had a ACL reconstruction with a hamstring graft, don't jump to this exercise.
Too early. Yeah.
Too early, exactly.
You might wait 6 months, 3 to 6 months for that after an ACL.
All right, a nice good core exercise is, we call it the plank rotisserie. So it's going to go into her hands and feet. You want to have a really nice tight core, neutral lumbar spine. She's squeezing her glutes. Shoulder blades are nice and flat on her rib cage. And then you can hold that. And then she's going to try to do the rotisserie and go onto one side. Now she's putting all the weight on the left arm, and she can add some hip abduction work as well by lifting her right leg. There's a lot going on here with the core, with the shoulder, with the scapula, and the glutes. Okay, and then she can go back into a plank and lift the other leg. Great, thanks.
That was the best idea to get Brent to come and demo.
Last year we tried to do it.
That's
We're both
right.
like,
Oh my God. Okay, and do you go straight to the side or are you allowed down?
go straight to the side.
There you go.
Yeah, whoa, there you go. Hold that.
Not bad.
Other side. And hold that.
I think that gives you perspective. I love it.
All right. This little tool is called the penalty box, and it's it folds up, so it's really handy. And you can have this at home. Hopefully you guys can see this. There, perfect. Okay, so there's all sorts of different patterns that you can make up in your living room. And so you can start with 2 feet, back and forth, and all different angles. You can go back and forth.
I think there should be a beep when you touch the line.
And then you can add one-footed jumps. And this is that agility and proprioception, training your body to be able to work quickly, to be able to go forward and back, side to side, and really mix it up. Okay, and then some more ski specific, side to side jumping. And even if you don't have a penalty box at home, you can just get some tape on your carpet or use the tiles in your house, and you can come up with, like a lot of people have agility ladders, same sort of thing, but just smaller and easier to use. This is also, you can make a little bit of a hurdle. So you can do various jumping exercises over it. All right. Let's go like this. Okay, and then lastly, so of course there's many exercises to do, but these are some of the important ones. So you can get a piece of tubing and have your friend hold the tubing. And then Britt's going to go into a slalom side to side jump. Again, thinking about her biomechanics, her alignment. And so you can do it slowly and hold for 3 seconds, working on balance as well. Or you can go more for strength and speed and back and forth, back and forth. Good. And you can do that on either side.
So Lynn, if I'm not used to this, how would I progress a few of these? What are some strategies to be not overwhelmed?
Right, that's a good question. Obviously, these are some fairly high level exercises, but just start really slowly. Maybe just add a couple of the exercises each day, and don't do too many repetitions so that you can sense your knees and your hips. Is it too much, or can you take more? And the amount of resistance of the band, obviously, start with a really light resistance or no resistance and progress to a stronger resistance. Keep the weights small or no weights at first. So it's a weight, a resistance, a speed, number that you do, and how many exercises you do in a session.
Are there any skiers that shouldn't do these exercises?
if you have certain injuries, maybe there may be some things that wouldn't be easy on you, but
But my point being is, I think we should all try to do some level of these preseason balance, agility, strength, and take them to our own levels. So all of us sitting out there have no excuse. I don't have an excuse. I've got some homework. And I know that we're going to have this portion available for people if they want to come back to the foundation website and see the video again. You don't have to have memorized it in this little presentation because I've got some homework to do, and I just want to make sure everyone should be aware that participating and getting this going prevents injury, and that's a big part of that. And it's super cool to see you performing at this level because that is the top level. Me fumbling away, I work on core every day, and and it's just not, it's not the same.
there you go. So everyone can just start at where they're at and progress. Good. See, you're getting better already.
Awesome. Anything more there, Lynn?
I think there was just a couple more slides.
Sure. So we're going to go into, after a few slides, a question and answer session. If people have some questions, we're going to be happy to answer them. We've kind of gone through these exercises. Yeah, I think we can go on there, Julianne. And we want to thank people for coming out and participating. And I will say, we do get support. We get support from we can keep going. Yeah. And we've kind of gone through these. So here are some slides just showing what we've shown. And I think you can come back to this. I'd like to go to that last slide so I can thank some people. So our foundation for these educational programs has been supported by the Banff Canmore Community Foundation, the Calgary Foundation, Rocky Mountain Rehab. I want to thank Lynne again. I want to thank Delia again for her participation, the town of Banff, the town of Canmore, and the Banff Sports Med Foundation. But if there's some questions out there through the chat box, I think Julianne probably has a couple. We'd be happy to go through and answer some questions.
I actually have one from earlier.
Okay.
Is there any differences in recovery after knee injury if you have rheumatoid arthritis?
So rheumatoid arthritis is an inflammatory process, and it depends where you are in your stage. In other words, if the disease is active and inflamed, that does slow down your recovery. The other part about rheumatoid arthritis is medications that settle down the arthritis and make it quiet again. Also slow down tissue healing, tendon healing, muscle healing. So the short answer, if you do have rheumatoid arthritis, I want you to be active. I want you to move. I want you to ski. But yes, recovery does take longer, has to be progressed at a slower rate. And that is part of that disease. And, treatment now is so much better for it. But, it is definitely exercise, skiing is encouraged. So that's my answer to that one.
Another one from earlier. Is it safe to ski after one has had a total knee replacement surgery?
Is it safe to ski after someone's had a total knee replacement surgery?
Some surgeons don't recommend it. However, many people in the Bow Valley have had hip and knee replacements, and many of them ski very well and do just fine. They might have to dial it back a little bit, just the risk of dislocation or perhaps injuring the replacement is possible, but I've seen many people, if they have a good rehab post-surgery, they do very well. And
I'll just from the medical side of things and the surgical side of things, I'll reiterate what Lynne said. You can ski with hip and knee replacements. The concern is if you injure that replacement, either dislocating your hip or loosening a knee or hip. So the answer is please keep skiing, dial it back. And I think Lynne nailed it. We have master skiers out, ski racing, but they're doing it for fun and a smile on their face. So really good question, and it's a common thing. Any more questions out there?
Just a comment, one person, Jocelyn says, I sure miss your prevention classes, Lynne.
Oh, me too. We'll start them up again someday.
Yeah, and
I
we're
did a ski conditioning
hoping
class for
the
many years.
Knees4Skis comes back again in a live format, so we can have people and exercise mats and go from there. Anything else, Julianne? Well, thank you, everyone who did join us on Zoom. We do have a little questionnaire. I don't know whether that's going to work. So
When the meeting ends.
yeah, when the meeting ends, we'll have a questionnaire.
There is a question.
Oh,
With proper rehab, oh, where did it go? Sorry. I did see a question pop up.
I saw that too.
Yeah, where is it? I don't know what happened to it.
you lost the question.
Oh, with proper rehab, can you ski as hard after ACL replacement?
Yes, that's an absolute truth. And I can tell you, in following sport for 30 years, one of the things I've learned is that many skier has done better after the reconstruction in a professional and in a ski career. There is a learning about yourself, learning about recovery, learning, you get a maturity from going through injury. And I've seen time and time again, people have their best performances after knee reconstruction. So it is not a career-ending injury at all. And sometimes it does. It gives you a boost of wisdom and when to strike. And more serious on your dry land and more serious on being an athlete. And so I can't state that is a truism.
And I have, some patients, sometimes they think when they've torn their ACL, that's just the end. They just can't ski anymore. And it's just someone told them that, or they thought that. But I try to encourage everyone that it's definitely possible to ski and ski hard after an ACL injury and surgery.
And I'll finish off by circling back to the very first picture of the knee. It's not the ACL. We're actually good at fixing ACLs. It's the other damage in the knee that causes problems. And we're getting better at dealing with arthritis and getting better at dealing with meniscal tears. And on the horizon are meniscal transplants. And we're doing that in certain situations. And so I actually see more hope for the injured knee every decade down the road. I think there'll be improvements in our ability to get people smiling on the ski hills again on a nice POW day. And that is kind of why I want to circle back to that. Keep getting out there and skiing. All right. I'd like to thank everyone. And
One more question.
We got another question.
What is the best option for arthritic knee with no meniscus right now?
Moving, being active, doing everything in your tolerance, hanging on as long as you can to get a knee replacement. But if you start not going out, if you start saying, I've had it, I've done enough, then that's the signal to get that knee replacement. Knee replacements aren't perfect. They do have limitations. Some are stiff, some are painful. But the secret, if you have arthritis and no meniscus, is move, move, move. A little less impact, but keep moving. And arthritis has waves. It has times when it's bad and times when it's better. And you go through crises where your joint is inflamed and angry. And then you'll go, oh, I'm doing well. I'm gonna put one from today. I saw a patient whose one knee was super inflamed and angry, and they had early signs of arthritis. And the x-ray of the other knee was way worse from an arthritis point of view, but they had no symptoms. And that's a reminder to me that arthritis does have phases. And so keep moving, get out of bed and get to the hill.
And there are some knee braces that help a lot with arthritis. There are some injections called hyaluronic injections that sometimes are done, and physio exercises, acupuncture. There's lots of things that can be done to help settle your knee and get you back out there.
And would that be the same advice, Mark, for someone with a partial meniscus as well?
Yep. We want to keep people moving, and if you've had part of your meniscus out and you're starting to get somewhere, the answer is the same. Okay, I think we'll call it a wrap.
Okay,
Thank you,
get
Lynne.
everyone doing your exercises, and hope to see you out on the hill. Thank you, Dr. Hurd, for an excellent session.
Thank you, Lynne, for your contribution. All right.